Thank you for joining us here at the Florida Department of Health Tampa Branch Laboratory. I'm pleased to have the Lieutenant Governor here, State Surgeon General Scott Rivkees, our Deputy Secretary for Health, Dr. Shamariel Roberson, and Education Commissioner Richard Corcoran. And I did see some Tampa luminaries behind. We got the mayor, we got the senator, we got the sheriff. So we really appreciate you coming out. Last week, Jeanette, Scott, and myself met with Vice President Pence, the Surgeon General, and the Assistant Surgeon General here in Florida to discuss some of the efforts for preparedness here and then to give our input on what the federal government could do to help. And the Vice President assured us that we would have their full support. As you know, last night the Department of Health announced that there are 2 presumptive positive cases of coronavirus disease in the state of Florida. The first patient's an adult resident in Manatee County without travel history to China or other countries identified for restricted travel by the CDC. The second patient is an adult resident in Hillsborough County with a recent history of travel to the affected areas in Italy. In total, 23 people have been tested in the state of Florida. The state is currently monitoring 184, and in total, 795 have been monitored. Now, those 2 individuals that tested positive remain in isolation at this time. Despite these cases, the overall immediate threat to the public remains low. With that said, we do anticipate that more will test positive, and we have taken additional actions to help contain the virus's spread. Last night, I issued an executive order establishing the Department of Health under Dr. Rivkees' leadership as the agency responsible for the response and coordination of the relevant state agencies for the COVID-19 response. In the order, I also directed the Department of Health to declare a public health emergency to better equip our state with the resources needed to handle this threat. The public health emergency ensures that healthcare providers, hospitals, and labs immediately report all suspected cases to the Department of Health. It also advises individuals of the proper protective measures that need to be taken regarding the possible exposure to COVID-19. Now, individuals that have traveled to an area that the CDC has issued a warning level 3 or alert level 2 travel health notice, or those that have been in contact with someone who has traveled to those places, should immediately contact the Florida Department of Health upon developing symptoms. These symptoms include fever, cough, shortness of breath, or difficulty breathing. Current countries at a level 3 travel health notice include China, Iran, South Korea, and Italy. Japan is at an alert level 2. As many of you know, there have been extensive restrictions regarding travel from certain parts of China. We believe that there will be more restrictions in terms of Italy that the federal government is going to undertake. That would obviously be helpful for us as we're looking to stop the spread of the virus. The public health emergency also advises individuals who believe they may have been exposed to COVID-19 to contact their local county health department prior to traveling to any physician's office, emergency department, hospital, or urgent care center. If you look at this virus, the vast majority of people who acquire it will not require hospitalization. And so if you work through your local provider or county health department, rather than showing up at an urgent care center, that will help with the resources for other needs. And I've also asked Dr. Rivkees to work with Health Secretary or ACA Secretary Mayhew to ensure that our assisted living facilities and nursing homes are taking adequate precautions, particularly those who will be have entry to those. If you look at how this virus has unfolded, folks who are middle-aged, younger, healthy, tend to weather it fine. It tends to have a most deleterious effect on people that have either underlying health conditions or that are elderly. So we believe that that's a priority, and they're going to be working in conjunction with those facilities to ensure that their residents are protected. The Department of Health, under Scott's leadership, has been fully engaged from really the beginning of January with their response and epidemiology teams working on this issue. The Department of Health is now able to test for coronavirus here in Florida. Labs in Tampa, here, Jacksonville, and Miami can conduct the tests. This allows test results to be available within 24 to 48 hours. Currently, CDC is taking up to 5 days for results. Obviously, they have a lot of testing that they're having to do. We have an incident management team in place, and we're working in lockstep with the CDC, receiving multiple updates daily. Hundreds of dedicated DOH professionals are responding, including staff in Tallahassee Central Office and in each of our 67 county health departments. We've also engaged the medical community through correspondence and weekly calls and have established a DOH website related to COVID-19, www.floridahealth.gov/COVID-19. This is the best and most up-to-date source for information and guidance regarding the virus in Florida. State of Florida is fully committed, doing everything we can to respond to the COVID-19 virus. I have spoken with both Senate President Bill Galvano and Speaker Jose Oliva. I'm working with Dr. Rivkees and Dr. Robertson about any immediate funding that we may need, and mostly we're talking about personnel, and they were receptive to work with my office to make sure that the needs are met. So I would just tell people, the risk remains low. Please heed the advice of the CDC and local healthcare professionals. You hear some of the things about washing your hands and not touching your mouth and your nose and your eyes. I mean, that really is the best way to make precautions here. And I think that we're working diligently and Scott will go into a little bit more detail, I think, on some of the things that are be doing specifically. But our goal is to contain this and make sure we're ensuring public health. So with that, I'll let the doctors come up and say a few words, and then we'll be happy to answer any questions you guys have. Scott?
Yeah. Thank you, Governor. Thank you all for being here. I want to begin by thanking Lieutenant Governor Nunes and Governor DeSantis for their incredible support as we are facing this, and also our other partner agencies. Preparing for this new virus is what public health is all about. As the Governor mentioned, we have 2 presumed positive cases in Florida. This means that these individuals have tested positive in state laboratories and are awaiting further confirmation from the CDC. Our wishes and thoughts are with these individuals. The first individual is a male in his 60s from Manatee County who is hospitalized for evaluation and treatment for pneumonia. This individual is currently stable and remains hospitalized. At the present time, it is not known how this individual was exposed to COVID-19. The Florida Department of Health is working closely with this individual, his close contacts, and healthcare providers to isolate and monitor any individuals who may have come in contact with this virus. And we will be implementing testing of any individual who may develop symptoms of COVID-19, which is shortness of breath, fever, or a cough. The second patient is a woman in her 20s from Hillsborough County who recently returned from northern Italy. Northern Italy is a site of a large outbreak of COVID-19. This individual is currently stable and remains under continued isolation and medical care at home. The Florida Department of Health is working closely with this individual, her close contacts, healthcare providers to isolate and monitor individuals who may have been exposed. COVID-19 is a respiratory virus transmitted like the flu. Symptoms of COVID-19 are fever, cough, and shortness of breath. Symptoms may occur as soon as 2 days after exposure or as long as 14 days. As the Governor mentioned, most individuals with COVID-19 will have a mild case. 80% of individuals will be able to be treated and observed at home. Up to 15% of individuals may have a more severe case requiring hospitalization. Up to 5% of individuals, this may be especially severe. In the elderly, and those individuals with underlying medical conditions like high blood pressure, heart problems, obesity, and diabetes, may be more prone to develop serious complications should they contract COVID-19. There is no vaccine to prevent COVID-19. At the present time, we do not have any medications to treat COVID-19. Thus, care is supportive. Since we have 2 presumptive positive cases of COVID-19 in Florida, I would like to announce several measures for our residents and visitors to follow. First, regarding travel. Before planning overseas travel, please refer to the CDC website, which identifies areas of travel concern. In addition to China, There are currently large outbreaks of COVID-19 taking place in northern Italy, South Korea, and Iran, with more than 1,500 cases there. If you are returning from these areas, we are asking that you self-isolate for 14 days after returning. Please refer to the Department of Health website for what this involves. This applies going forward to individuals returning from these areas and from individuals who have returned from these areas within the past 14 days. If you are self-isolating and become ill, please contact the county health department or your health care provider before seeking medical attention. We'll be sure that guidances and proper protection are taken when we obtain your samples. Regarding healthcare workers in medical facilities, all healthcare facilities and healthcare providers are asked to review the expanded definitions as to when to consider COVID-19 in an individual. This includes individuals returning from areas of global high outbreak within the past 14 days and lower respiratory disease symptoms. This includes individuals returning from China, South Korea, Iran, Italy, and some parts of Japan. We also are now including individuals who have new onset lower respiratory disease without a known cause as individuals who should be considered for COVID-19. Please contact your local county health departments when you're evaluating such individuals. We will assist in their evaluation collections of samples. As the governor mentioned, we are now doing testing in Miami, Tampa, and Jacksonville. Healthcare providers and workers are reminded that all individuals who are being evaluated either in the outpatient or inpatient setting for lower respiratory tract illnesses should have respiratory or aerosol precautions in place. Please refer to CDC and DOH guidelines for this. We need to protect our healthcare workers from getting COVID-19. Regarding nursing homes and other residential facilities, recently an outbreak of COVID-19 was reported in a nursing home in the state of Washington. Please review your visitation policies and consider restricting visitations. Please screen all visitors for being ill and restrict anybody with any sign of illness from visiting. Universities. Colleges and universities are areas of high-density interactions and housing, and many have international programs, as do some secondary schools. Please refer to CDC guideline travel restrictions. If you have students returning from high outbreak areas, please assist these individuals in self-isolating for 14 days after their return. Commissioner Corcoran will be working and helping to get messaging out about this important issue. If any of these individuals become ill, please contact our county health departments so we can assist in their evaluation. And lastly, for the general public, as the governor mentioned, the risk to the general population is currently low. You can go about your normal business, but there are ways that you can protect yourself from COVID-19. Avoid close contact with individuals who are sick. Stay home when you are ill. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your cough or sneezes with tissues and then disposing of the tissue. And wash your hands frequently with soap and water. These are measures that will protect you. Today is an important day for all of us. We will continue to provide regular updates as this is a rapidly evolving situation. Please see the Department of Health website, which the governor referred to. The site will also direct you to the Center for Disease Control website as well. In closing, I express my thanks to Lieutenant Governor Nunes, Governor DeSantis, members of the Florida legislature, our federal government, especially the CDC, and our fellow state agencies. I also very much want to thank the members of the Florida Department of Health who are playing a tremendous role in protecting public. Thank you. Dr. Robertson?
Thank you for the opportunity here today. We have an integrated, accredited public health system in Florida, which includes 67 county health departments and 3 public health laboratories, and many partners that we are working with to respond to COVID-19. Please remember, if you have traveled to the affected regions that are experiencing sustained community spread of COVID-19, which include China, South Korea, Iran, or Italy, and have symptoms of either fever, cough, or shortness of breath, or have been in contact with a confirmed COVID-19 patient within 14 days of symptoms onset, or you are a person with severe respiratory illness without an alternative diagnosis, please call your county health department to help facilitate transport. This is what a person can expect if they present to a healthcare facility to be tested for COVID-19. If you meet these definitions and you are a person under investigation, that healthcare provider will take specimens, oral, nasal, and sputum, which is also saliva. They will then work with the county health department to either send or take that specimen to the public health laboratory, and then if it's negative, it stops there, and if it's presumptive positive, we are sending at the current time to CDC for confirmatory testing. Approximately the time for test results are 24 to 48 hours, and we are taking all necessary precautions at that time to isolate those individuals and prevent the spread of disease. Once individuals are identified as a person under investigation, we are then working to identify their contacts and reduce the spread of COVID-19. I just want to reiterate, we are poised and equipped to respond to COVID-19 in Florida.
Great. Any questions?
Governor, before you wrap us in with Channel 10, can you tell me why it took 5 days to test the patient in Manatee County?
Scott?
Thank you for your question. On Friday, we announced expanded consideration for COVID-19 to include individuals with respiratory disease of unknown origin. And it was that important alert that actually came out from the Department of Health that resulted in the facility collecting the samples Friday and sending it to us. Also, this gets into the issue of testing. As some of you may have heard, there was a delay in testing. On Thursday, the Center for Disease Control actually sent out new protocols for the kits they had sent. Friday, our Department of Health teams, including right here, worked on optimizing the new conditions, and on Saturday, we were ready to test. So in this situation, samples collected Friday when we issued our new guidelines and was run on Saturday.
With that delay, how many others were exposed to this?
This is something that we're working with the hospital on to identify other individuals who would be exposed. If an individual is exposed, those individuals are being evaluated, and those individuals will self-isolate for 14 days.
Why did it take so long to get the information out to the general public? This was out on Facebook yesterday. Doctors Hospital put out a letter to their doctors, to their patients yesterday. The health department didn't put out a press release till yesterday evening. Why did it take so long?
As soon as we became aware that this individual had COVID-19, which actually was Saturday evening, we launched an immediate response, which is what our goal is, and that is first to make sure the individual is stable, and then also to employ containment measures, which has to do with identification of individuals who may have been exposed. So as soon as we became aware that this individual had COVID-19, measures were put in place in terms of containment and launching an evaluation of individuals who may be at risk.
24 hours before it was publicly announced?
We became aware of this Saturday evening, and in terms of what the process is at the present time, is that these individuals are identified as presumptive positives because we're doing the state laboratory, and then according to the CDC, we're supposed to send the samples to them where they do confirmatory testing. We are still awaiting on that. But because of the situation, and we had already launched full measures in terms of containment and evaluation, we decided that even though while we are waiting for the CDC confirmatory testing, that was important to go ahead and inform the public.
When you waited 24 hours to let the public know.
She's not trained. And do dealing with this virus? What are you doing to ensure that hospitals are individually trained so that their healthcare professionals can deal with this crisis?
That's a very important question, and this is a point that we actually had commented on. So starting 3 weeks ago, we have had weekly calls with the healthcare community in the state of Florida. We knew this was coming and having individuals be prepared. So we, right from the very beginning, have asked the institutions to refer to their planning, respiratory precautions, make sure they have enough protective equipment, and so the procedures are in place so that the healthcare workers can be protected.
Do we know how recently the Hillsborough case, that woman was in Italy, and what the exposure was like, say, on the plane when she returned? Are there any protocols in place for that?
I don't have information at the present time, but we're working with CDC and our health department as far as evaluating all of those issues.
Can we talk about Department of Health office alone?
How many of them involve travel?
So in terms of individuals that we are currently following, so let me break it down to a couple of different categories. So we have individuals that we consider persons under investigation or have been. These are individuals who would be high risk suspected of that. We have tested 15 individuals. These individuals have been negative. There are 2 individuals who are presumptive positive, which we talked about, and then we're waiting on 6 other individuals. And then we have another group of individuals. These are individuals who had returned from mainland China, and these individuals are self-isolating at home. There have been more than 800 individuals that we have monitored, and within that are 184 individuals that the governor referred to that we are currently monitoring.
How many of them involve travel?
The 184 individuals are specific individuals who have returned from mainland China, not from the Hubei province, so all travel, sir.
Doctor,
With the delay of the
contacting all
testing,
this
with the delay of the testing of the manatee, are you concerned, how likely is it that there's going to be more cases of coronavirus moving forward the next couple of days?
It's very important, this is a new virus that we're continuing to learn about. And with the expanded definition for coronavirus, to consider this in situations where an individual has lower respiratory tract disease and you can't find it, as we are testing more individuals, and we can do this now in each of our state laboratories, we'll get more information as to how common this is going to be. I don't have information on that at present.
One more question.
Called this a hoax when we tried to confirm this yesterday. Yesterday evening, we called the Department of Health out of Sarasota and they called this a hoax, completely false, only to backtrack hours later with the press release. Why would they call it a hoax? It's strong language.
I can only comment on the fact that we are all here right now today to inform about this important development within our state. We have always been very proactive in terms of letting the public know that this is coming and how to prepare ourselves. And
That's not transparent, sir. And your department called it a hoax.
Excuse me. I'll just say, so we, just to kind of answer, I think, your question there, I mean, and I said in my comments, we are anticipating that there will be additional positive tests. The gentleman that was hospitalized did not, before the CDC guidance change, fit the criteria where you would test for COVID-19 because he had not been exposed to travel, and we don't think he had been exposed necessarily to people who had been, although I think that that's under investigation. And so the follow-on for that will be, we think that there'll likely be more. The young woman who came back from Italy, did have a roommate who is now under self-isolation. We anticipate that is somebody that was probably exposed. I don't think that's someone that's a Florida resident. I think it's a different state, so it wouldn't necessarily count as Florida, but obviously the precautions are being taken. Our goal is to, limit this spread, of COVID-19, and I think from the beginning, the Department of Health in Florida, they've been very proactive. I mean, you don't monitor all these people. I mean, that involves personal visits. That involves checking people's temperatures. And so they've been very diligent about this. And then obviously with these cases, they've proactively been contacting the people who may have had interactions with the patients. And so we're going to continue to do that. I'm glad that we're going to get support if we do need some additional funding from the legislature. And I hope that the U.S. Congress, will be able to do something soon. I know they talk a lot about different things, and they have their own views, but they, oftentimes don't act quick enough. So we hope to see that. So thank you.
What about tourism? Have we talked to the local parks? Have we talked to Visit Florida about tourism?
I wish.